الكل كاترايزيشن بالبير
بل ممكن
يشتعل هذا يعني النقطة دي
على السكراب يعني ممكن يصير بها فلان لأنه يستخدم في فلان واحد يكون يدير باله بس مثلا بيش الكربات يورينيت فور اكزامبل لونج سيرجري عن شي يورينيت أو مثلا احنا بدنا نشتغل بدنا نسوي نشوف التيوبال فاكنسي وندفع داعي هم نسوي ويتنس صح لا مو صح فهاي ممكن تصير عندنا بعدين نرجع نسوي الكتروكاتري بالأزمة سيرجري ممكن تصير عندنا.
Yes, a very important point because fluid and especially water keeps the heat in itself and it boils it's like that we have applied hot water to the patient's skin. It's exactly the mechanism, very important point I just stressed. And about the bipolar, one complication or one disadvantage of the electro surgery is still in the old bipolar, and that is overcooking. We said that overcooking occurs when we apply the heat continuously to the tissue, and the three-dimensional collagens become two-dimensional, and then they will combine with oxygen and they will become charcoal, and they will have no structural strength anymore. This also happens with bipolar. But for solving this problem, a new generation of bipolars have been introduced, and this generation has between the jaws of the bipolar, this is the tissue. They have sensors for heat, and it senses when, which said that coagulation occurs about 40 to 45 degrees. At this temperature, coagulation occurs. This sensor, when the temperature reaches 40 to 45, it stops the current automatically. So we will have less overcooking. And this new generation is, as you see, tissue response electrosurgical generator. The prototype is Ligosure. Ligosure is a brand, but the generic name is tissue response generator. These are the old bipolars, which a sensor for heat is added to the jaws of the grasp. And about this, for in the optimum conditions. In optimum conditions, the factory says that we can use it for up to 7 millimeters vessels. Well, this assumes optimal conditions, but we usually do not operate on optimal conditions. The generator may become uncalibrated, and the handpiece, which is recommended to be single use, we use it many times. So this cannot be considered optimal conditions. And usually we do not use it for vessels that are named, anatomic named vessels. For vessels that do not have names, 2 to 3 millimeters we are confident on, but larger than that we'd rather clip or put hemolock on them or staplers on them. We will hesitate to put the tissue response generator on them for the reasons listed. And okay. Very important. This is the anatomy structure of what happens to the vessel when we apply the bipolar current to this. As you see, the collagen in the vessel wall will melt, and from 3 dimension it will become 2 dimension, and it will fill the lumen, and it will become like this. It will become like this, and it will be, the bleeding will stop. And about the reliability of tissue fusion, how much is it reliable? They have done experiments, and in the laboratory, they have put blood vessels and put the pressure up to 40. 40 is unphysiologic. We do not have, we have never seen blood pressures more than 20, 25. But the blood pressure has been taken up to 40, and they see what happens to the ligated or controlled vessel. The best one were ligatures, sutures. Sutures had the best result. None of them opened when the blood pressure was elevated to 40. The next one was vessel sealer, the tissue response generator. You see the person. Clips was next, standard bipolar, and the worst was ultrasonic coagulator, which I will talk about it. 95% of them opened when the pressure was elevated to 40. So this tissue response generator is a reliable vessel. And this slide wants to compare electrosurgery to ligature. When it is better to use electrosurgery, when it's better to use ligature. For vessel sealing, ligature is much, much better. 3+. For vessels, but for dissection, it is not good. Only 1+. But electrosurgery is much, much better for dissection, but less good for vessel sealing. The opposite. So this gives us the opportunity to know when to use electrosurgery, when to use Sالم, bipolar or tissue response generator. It is no good for dissection. As I said, that is the reason we cannot throw away our monopolar generator. And for application of the bipolar or ligature, there are a few principles to keep in mind. First of all, we must completely dissect what we want to take. We cannot take without seeing what we want to hemostate. And we must consider presence of limited thermal spread. It must not be close to vital structures. If we take the tissue close to vital structures, thermal injury may occur to the adjacent structures. And the maximum diameter of vessel, they say 7 to 8 millimeters, but we use less because we do not do it under optimal conditions. And this is also important. Some seal it double. They take the vessel and when it is finished, they do not cut. They release it, go a little bit up or down, depending on the anatomy, and seal once again, and then they cut. This is a good maneuver if the surgeon judges it. Another important, three more important principles. The volume of tissue between the jaws must be appropriate. We must not take too much. It will not work properly and we may have bleeding. Another important thing is if the blood vessel is very thin and does not have enough wall. Yes, exactly. If it does not have enough collagen, it will not fuse. And when we cut, it will start bleeding. If we want to hemostase a vein, we should let the peri-adventitial structures leave it on. So the collagen is enough, so it can seal the vessel. We must not clean the vein. For the artery, it is acceptable, but for the vein, we should let the peri-adventitial tissue to remain on it. And the other principle is do not apply traction. If we apply traction to the structure, it will cut faster, and we may not have a good hemostasis. It may bleed. These three principles, especially the second one. The second one is very important. Do not clean the veins. Especially the larger the vein, the less will be the proportion of the thickness of the wall to the lumen.
The media
thickness of the
media
taking.
intima media adventitia. The media is very thin in vein,
Yes.
but in artery it is
We must let the peri-adventitious tissue to remain. Okay. And we will talk about
small vein. Not used to get in small veins.
no, we can't use one vein, but the diameter should be observed. 4 millimeters.
كل الفين.
Not like sexual.
Yes. And the other
Tubal ligation. For tubal ligation. Thickness.
yes, it can be used, and we would cut with it. Yes,
Yes.
it can be. But better than that is clips. Clips is much
Better.
more. Yes, it's much more better. And another energized instrument that I will talk about, and I will finish this session, is not harmonic scalpel. Harmonic scalpel was designed for 2 reasons. First of all, because a dissection is not good with the bipolar device. This instrument is designed for visual dissection, so we can dissect and hemostasis at the same time. And the second reason that this was made, it was because they wanted to get rid of all of the electricity. And the harmonic scalpel has a different principle. It generates heat not by electricity, but by friction. It's the cog. Do we have an
That's that.
Yes.
Yes, the
Friction.
yes, friction. Yes, friction of the jaws causes heat, and the heat causes the same effect on the tissue that I told about electrosurgery. Yeah. Yes, it vibrates and causes friction. Friction causes heat, and the same things that happened about electrosurgery, the same happen. And we will have yes, yes. But there are some limitations to this. The limitations there are some principles that we must observe. One is the setting of the power, and one is the setting of the tissue tension. The setting of the power is when we take the power of the harmonic scalpel high, the waveform will be like cutting. It will cut. The hemostasis will be less. The dissection will be better, and we can work faster, but the hemostasis will be a bit low. But if we use less power, it will be the opposite. It will have cut slowly, but the hemostasis will be better. So it depends on us. If we see that we are working in some where that bleeding is minimal, we can use high power, and the opposite. And the other matter is tissue tension. As I said regarding ligature, when we have tissue tension on the tissue, it will cut more faster. If our judgment is that we need more, we want to go faster, we can put some tension on the tissue and it will go faster. If we believe that hemostasis should be better and we are not in a hurry, we will not put tension and it will go slower, and a better hemostasis will come. And as you see, for the harmonic scalpel, the section is very good, but vessel sealing is not so good. At most 2 to 3 millimeters, we can hemostasis with harmonic scalpel, but not more than that. It will not hemostasis. And these are the principles that we must know when using harmonic scalpel. The harmonic scalpel has this one. Both of the jaws do not vibrate. Only one jaw vibrates. Correct? Or in the sleeve. So we must know that when only one jaw vibrates, this can produce heat on this side and both on that side. So, if the jaw that vibrates is applied to another structure, it can cause heat damage to that structure. In this instance, it is close to the intestine, it can injure it. In this instance, it is close to the blood vessels, and it can injure that. We must do it like this. This must go down. This non-moving jaw should go down. Yes. And another mistake is that putting too much tension will cause less hemostasis. And one more mistake is this. We should get it completely in our jaws. If it is incomplete, it will bleed. And another principle to observe both in harmonic and in ligature is we must go at right angles to the vessel. If we go at not right angles, yes, at oblique, the diameter will be more, and there is more risk of bleeding. The best hemostasis will be directly at right angles. I don't think that there's anything left. Yes, it is finished.
It should not be partial. You should cross all of those.
Yes, we should cross all of this. Yeah. Yes, we had it here. We should cross all the vessels unless we will have bleed. Okay, if there are any comments or questions, I have this. Thank you very much. Thank you.
صلوات بالدرب.
أنا أقول لك شخص أو ليش؟ خلاص الأول شوف شاطر أعتذر عن البارحة بس خابرني وخلص شحن الموبايل. خلص لما بعد بدي أشيله بس أقول لك إياها. إيه أوكي أوكي.
بريك يو هذا التوشيح بس.
يعني هي تاخذ علاجها هي كل يعني رغم السنين هو سنين 3 سنين واحنا راح نشوف السبب نتكلم مثل ما نتوقع انه يصير الحجم المناسب السبب فنلاقيها العلاج الخاص مع السبب يعني نشوف الأحسن الأشياء أي فهو هذه المرات لحتى نستخدم البصر فهو كان ضم صعوبة بالمرات